Hi there, Happy New Year 2026, and thank you so much for sticking with me throughout last year. Your views, your engagement gives me the encouragement to carry on producing health related content to help you make better life choices and to live healthy. Today, I want to talk about the ABCs of diabetes management and to emphasize that, diabetes is not just about the blood sugar. The blood sugar is just a part in the management of diabetes. And the ABCs of diabetes management are so vital in the prevention of complications that can result from diabetes. Diabetes is a disease characterized by persistent elevated levels of blood sugar. Persons living with diabetes are 2 to 3 times more likely to get a heart attack or a stroke or other cardiovascular diseases. The A stands for A1C, and A1C is the hemoglobin A1C. So red blood cells regenerate after every about 90 days. Normally, sugar binds to hemoglobin, and the hemoglobin A1C, is a good estimate of how well your blood sugar has been controlled over the last 3 months. Now, the B is the blood pressure, right? Generally, for persons living with diabetes, the target is about 130 systolic on 80 diastolic, right? This is because high blood pressure increases the risk of cardiovascular disease, increases the risk of strokes, heart attacks, and things like that, just like diabetes. Therefore, having diabetes and hypertension increases your risk of cardiovascular events even further. The C stands for cholesterol, right? So high blood levels of cholesterol, of the LDL cholesterol, increases risk of cardiovascular events, heart attacks, strokes, and other cardiovascular diseases, which is why it's very important that persons living with diabetes manage their cholesterol as well. Diabetes can cause certain complications, like blindness. Diabetes can actually lead to blindness by affecting the retina of the eye. So too, diabetes can cause chronic kidney disease. Poorly controlled blood sugar levels over time can lead to kidney damage. Diabetes can cause nerve damage, causing what we call a neuropathy. Diabetes also can cause non-healing ulcers leading to amputation. In fact, diabetes is still a leading cause of non-traumatic amputations. So how then do we manage the ABCs? Okay, lifestyle is vital. Your lifestyle is so important in managing the ABCs. And the good news about it is that the lifestyle measures you adopt for A works for B and it works for C. So isn't that easy? A little bit. So what you eat is so important, right? We want to recommend diet rich in fruits and vegetables and whole grains. You want to avoid fatty foods, fried foods, and things like that. This increases your risk for obesity. Overconsumption increases the risk for development of diabetes, hypertension. So too, it increases your risk for strokes and other cardiovascular events.